folks, the nucleus of everything that we do here at American Business Systems is through what we feel like is the world-class medical billing and EMR system out there. The iClaim and EMRX platform, which is all web-based, it helps the doctors not lose anything that they need in case of an emergency, or they're not in their office. Like a lot of doctors are not in their office right now. Imagine trying to do what you might hear us talk about today is some telehealth. What if the doctor can't get to their office and get on their server? Now where they're going to have to get all these different connections to their house. This one, doctors don't have to worry about it. We have all these different services, and again, we're going to be talking about how we're continually adding new services to the ABS suite of services that you can actually offer to the doctors. Everything from the compliancy, which is HIPAA compliancy, to coding, audit guard, code right, anything you can imagine, and the kitchen sink. So everything that you might need to help you get in front of a doctor. And folks, this is for every walk of life. Doesn't matter how old you are, doesn't matter how young you are, and anything in between. So this gives you an opportunity to be able to start a business in your home at any given time. And not only do that, you're not having to wait to come to what we used to have is live training. We're so grateful that we switched over at the beginning of the year, because imagine us having to jump through our own hoops trying to get our own live training all online. But we got all this started here at the end of last year and going into this year, and we haven't missed a beat. Matter of fact, we're actually able to deliver training even much quicker and helping our brand new licensees get started as a certified medical revenue manager, as you can see here. So at the end of that live online training, you're getting the same information as if you were sitting in a live class for 5 days. You're going to still get your certification as a certified medical revenue manager. Now, let me introduce to you, for those that have never met Patrick Phillips. Patrick is the founder and the CEO of American Business Systems, and he'll be kind of taking the lead in the interview process this afternoon with Jeff. But he is a contributor to several different things, like the editorial board of the Billing Coding Advantage magazine. He's written several books. He's in the process of writing some more. He's encouraged me to help write a book, and hopefully we'll have that listed here soon, in print very soon, because it's really going to be helpful. Patrick, I think I'm actually going to add one more chapter to it before we release it in print, and that'll be having to deal with telehealth medicine. So we'll get to that a little bit later. Folks, not only are you going to want to get some of these books, you can get some of these information online, but without any further ado, let me bring Patrick on here via the video. There you are. Patrick, we got lots of stuff to deal with this afternoon.
Oh my goodness, this is incredible. You know, I'm assuming that a lot of people are working from home. Maybe they're taking a break right now watching this webinar, or maybe they're not able to go to work and they didn't have anything else better to do right now to watch this webinar. So we're just thankful that you guys are looking at starting your own business, because folks, if there's ever a time that you should have a home-based business, this is it. And we've been doing this for 26 years, putting people into their own business. And you're able to work from anywhere, anytime, because it's all internet based.
Yeah,
let's
absolutely.
Take a look at an article here that you found, Eric, that is just amazing. Talk about zooming in, folks. Look, this is on March the 31st. You can see that right here if you look real close in this article. Immediate changes needed for physicians to stay in business during the pandemic. Eric, this uses the very term we've used for 26 years right here. Let me see if I can use a pen here. I haven't done this much, so I don't know if I can know how to do this. There it is right there, cash flow. This is a cash flow crisis right now, isn't it, Eric?
Excuse me, you bet. I just had something go down the wrong pipe.
Well,
it's live TV here.
It is live. So we use that term, cash flow. What we do, folks, you as our licensees out there helping doctors, you're helping them with their cash flow, helping them to get money into the practice by billing the insurance companies and the government agencies, of course, that pay the doctors. So without your help, the doctors are kind of floundering around on their own. Yes, some of them have their own staff and they all have their own software. They do it themselves, in other words. But believe me, folks, it's much cheaper to outsource it. They just haven't found somebody they can trust yet.
I'm telling you, right now is a perfect time to be engaged with some doctors, simply because these doctors are are hurting because the patient volume has actually gone down, and because of that, you're finding out that this is a great time to review what the doctors are doing with their billing, and where you can help them after this whole crisis, this pandemic, to actually move the curve for them in an upward format to help their cash flow go up.
All right, so folks, again, look at this. It says, will doctors be able to keep their practices open during the worst pandemic in our lifetime? Our country needs every available doctor in the country to fight the challenges of COVID-19. Doctors working in independent practices face an immediate cash flow crisis, threatening their ability to continue services. Eric, that's because nobody wants to go see the doctor right now. They don't have any patients.
Right. Yeah. Everybody's staying home, and they're only going is if they need it. And then we're going to bring up here a little bit later how we can increase the doctor's revenue by the doctors using one of our brand new services.
That's right. And look at that last paragraph. Private practice physician groups experienced an unprecedented reduction in in-office visits as they moved to provide a safe and secure environment for patients and staff. In compliance with CDC guidelines, practices suspended preventative care, non-urgent visits, non-emergency surgery, and office procedures.
Yeah.
So, Eric, I can't think of a better time for somebody to get started in this business, because even though a lot of folks are confined to home, depending on what state you're in right now, as far as marketing to doctors, we've already figured out how to do that digitally without having to go out and contact the doctors in person. And besides, in a month, 2 months, who knows, hopefully, by the time people get through our training, they will be ready to go out probably and see the doctors and build the business. Again, it's just the ideal time. So why don't we bring on somebody who's been in the business for a while? Our guest today, Jeff Brunner. Let's see if Jeff is still with us, and he can even turn on his webcam if he's there. Hey, Jeff.
Sure.
How you doing?
Good. How are you, Patrick? Eric, how are you?
Doing great.
Jeff, you're in Michigan, right? They're pretty tight, locked down right now, aren't they?
We are tightly locked down. I'm speaking to you from my kitchen table here. Speaking of working at home, and we're locked down like you read about. It's necessary, but hopefully it'll be relatively short-lived here.
Yeah, and so Jeff, let's just start by finding out from you what you've done with your business so far. Remember, most of the folks on here probably have never heard of you, and so just kind of share your story with people, how you got in the business, maybe what you were doing at the time, and where you're at right now.
Absolutely. No, I'm coming up on my third year in this business as an ABS licensee. Back about 3 years ago, I had a chance to take an early buyout from the company that I was working with for almost 30 years. As you can tell, I'm a little bit on an age here. I'm not a spring chicken, so to speak. But I knew that at the time, and I still feel that I'm young enough to where I want to do something. I didn't want to just twiddle my thumbs, and do nothing. So I investigated lots of different franchises. I don't consider ABS a franchise at all, as a matter of fact, because there's no ongoing royalties that you pay. But I knew I didn't want to open a store or have a place where I went to, from 9 to 5. I didn't want to buy myself a job. I wanted to have some sort of an opportunity where I could work anywhere remotely, which this allows for. I knew, I had some experience in sales, so I knew that I could succeed at that, and I was comfortable with talking with physicians as well. But it's worked out really well. I'm building this at my own pace. It's definitely a work at home if you want, or at the very least a remote business. Heck, I take my computer with me when we go, to Hilton Head or Florida or anywhere on vacation, and I wake up before everyone else does first thing in the morning, do a little bit of work for my clients, and continue my business that way. So it can be done. I'm doing it, and it's worked out really well so far.
Yeah, I mean, your home office is your office, right? You don't have a separate office you rent or something.
No, I work right out of my house. I have my office right here in my house, and from time to time I'll go visit clients at their place, and I'm always in contact with my clients, but everything is done right from home.
Yeah. Jeff, here's a great question that's come in already from Abinka. Says, is this not a saturated profession? How am I sure I won't be frustrated with seeing doctors to work for, or seeking doctors to work for. Have you found that a problem, that there's a lot of competition, or, you know, you got several clients now, right?
Yeah, I've got several clients. There are, certainly other companies that do, medical billing for practices. What I was really surprised at when I first started was how many offices are dissatisfied with their current billers. I'm going to talk just to outside billing services. If you provide good service, and if you work hard for your clients, you'd be surprised at how far that goes. And that's what I've done, and it's that has worked out well. There is competition, there's no doubt. I think that we've got at our availability here really remarkable tools. I think iClaim is as good as any system I've ever seen as far as getting being easy to use, getting really quick turnaround in terms of payments. There's often that I get payments from payers within 3 days of when I actually plug them into the system. So there's just a lot of things that we can bring to the table that other companies cannot bring to the table. Ideas for different streams of revenue for practices, and as I say, so far so good.
Yeah, and people don't realize that there are other software, of course, out there that doctors use to do medical billing, but not a lot of it is cloud-based. I mean, they're moving that direction, but some of it is just kind of pieced together. You've got your practice management system that you do the billing. You've got another system that you do the electronic health records. You have another system for maybe you have telehealth. You have another system for, they're pieced together. And we basically have set this up so that it's all a unified system with a built-in clearinghouse, so that you don't have to worry about picking a clearinghouse and which one do I trust, which one services the customer better. We just figured all that out already.
Right, it's all self-contained. Without getting too much in the weeds, there's a product, Denial Defender, which is part of the iClaim product, and I have that with all of my clients. And it's I literally click a button, I prepare a claim, click a button, it tells me if that claim is going to go through or not. And so in other words, and that can save days, if not weeks, of time with a practice getting paid. I use that with every single claim, or we use that with every single claim that we send through. And as I say, it tells me right away, or whoever's doing the inputting tells them right away that if a claim is going to go through and how quickly, the fact that it'll be paid quickly. And so yes, it's all right there.
Hey, some questions have come in about should they be seeing slides. Folks, you notice that I can turn the slides on or off. So right now you should just be seeing Jeff and I talking, but sometimes we'll throw a slide up there because it has something to do with what we're saying. So that's and if you're on a phone, you may have to swipe left or right to see us or the slide. But anyway, hey, there's a great question here. One of them is just basically from Ivan. He says, how much do you invest in marketing every year? People are concerned that they might have to spend a lot of money. Have you spent a lot since you started?
Well, part of I don't know if I'm an outlier on this or not, but I don't spend a whole lot of money on marketing now. When I first started, honestly, I used the materials that came with the ABS package. There's a I don't know how much you've talked with the folks who are online, but as an ABS licensee, you get an entire package of marketing materials that you can order and distribute, and that's what I did. I mean, I developed some letters that would go with a letter of introduction for my business that would go with let's say a flyer on iClaim, let's say, and I would put those together, go to an office, drop it off, introduce my company, and use those real regularly. What happens? What's interesting is that once you get clients, and I'm not saying this is in all, I'll speak for myself. Once I got my first 2 clients, which took, first one was about 2 months after I left training. I signed my first client. The next client came about a month after that. So, and it got real busy fairly quickly. After that, everything has come by referrals. So yeah, you can spend money on marketing. If you do a good job, you'll be surprised at how much comes from referrals.
Well, that's what we found from most of the licensees that I interview. You're right, Jeff. They say, well, we just did what you told us to do to get the first client, and maybe even the second one. And then those doctors start referring other doctors to me, and it just kind of grows organically, doesn't it?
Yeah, if you do a good job for your clients, and if you show that you care, as I say, you'd be surprised at how many companies do not do that. And if you show that you care about the practice and you care about the people involved, they like to share that with their friends, who many of whom may be physicians or nurse practitioners or what have you. So yes.
Yeah. I just realized that I was sent by one of my staff members during this webinar another great article. So I'm going to throw that up on the screen right now. Look at this one, Jeff. This is from Managed Healthcare Executive. As you can see, it says cardiology organizations bracing for major revenue drop because of COVID-19.
Mm-hmm.
It's just incredible how doctors are. Listen, folks, if there's any problem that a CEO or owner of a company or a medical practice has, it's all about cash flow. Without cash flow, you don't have a business.
And I can confirm that with the clients that I have, I can confirm this is in the forefront of their minds. I can tell, or we can tell when we look at their daily schedule, the numbers of patients coming in, obviously, and there's been a drop off. But this is a time that folks really need us, really need us as medical revenue managers to first of all do a good job for them, but secondly maybe bring some different ideas to them that will help boost the revenue that will either keep them in business or help them kind of catch up, if you will, with what may be a lost revenue here so far in 2020.
Yeah.
So there's lots of things that we can bring to the table, but I think it's important that we bring ideas to our clients or to prospective clients, show them the things that we can do that will help them stay valuable.
Yeah, and that's the great thing about this business. We've been doing this. My wife and I did billing back in the early 90s, Jeff. I don't know if you remember that story or not, but we just noticed that there's never a time economically in the United States that we've been in trouble as a business, because it's such a solid, it's based on human beings getting sick,
Right.
and human beings going to a doctor, and then the doctor needing to get paid, and somebody has to do the billing for the doctor. Now, again, a lot of doctors in their office are, employing their own staff, of course, to do the billing, but those staff usually they didn't have a degree, they didn't have training necessary, they just kind of fell into it. They were trained by the person before them on the job training, and they're not really doing the job that we do as licensees. The difference is you get paid when you collect for the doctor, right?
Right. Yeah. And I heard you and Eric talk about this earlier. Without a doubt, we can do it less expensively than someone in-house. Now, I don't want to disparage in-house billers because they're very good at what they do. But that's again, we're talking about either making more money or saving a practice money. I mean, those are the two things that they're interested in: raising the revenues or lowering their costs. One way we can hopefully do both, but we can definitely lower the cost if we do billing outside the practice. You don't have to pay us. You don't have to pay me workman's comp or for my benefits, or God forbid someone gets sick, the biller gets sick and is out for a while. What happens then? None of that is in place when a practice uses an outside biller.
And Jeff, you may have a range, you may charge doctors different, but what kind of percentage, give people a feel for what kind of percentage of the collected revenue that you can charge the doctor for this?
Mm-hmm. I've got several different contracts and different ways of that I invoice clients. The industry average, or at least what I do, is I'm in the 5 to 8% range. My largest client is at 6% of revenues handled. So 6% is what I would say, and they're happy with that. I was able to lower their costs by 1.5 points. They had 7.5% rate with someone who wasn't doing a very good job for them, and they're real happy with me. I'm saving them money on their billing, and I'm actually getting them more money. But others, I have a small office, a small nurse practitioner's office, single provider. She is right on the edge as far as she doesn't have a huge practice. It's just her and her receptionist, and she's slugging it out on the front lines by herself. And she wanted to know what her fixed costs would be. So what I did with her is I gave her a flat rate per month to do her billing. I know I studied her volume. I knew exactly what she was going to do. I knew she wasn't a growing practice per se. She was an established practice that I knew wasn't going to be growing, exponentially. So I knew that she'd have a certain amount of claims per month, and as a result, what made sense for her was a flat, flat rate. And so you can do that, but you can do lots of different things. The folks at ABS, just for people who are listening, will help you with that. I trust me, not a clue how to structure a contract, and I called, and that's part of the many things that they support you on.
Well, there's a question here from Bianca that says, how many years experience would I require to start this business? Did you have any experience?
I had 0 years of experience. I didn't. That's really funny because I laugh every time I think about it. I literally knew nothing about billing. I barely knew anything about. I was comfortable with talking to physicians. And I had a pretty good sales background. You don't have to have a sales background to do this, but in my case, it helped, I think. But I was, I would go around and market my business. I had prospective clients, just real briefly, who were kind of moving closer and closer to being full clients, to being signed clients. And I finally got this one, over a couple months, I got this one client ready to go, or prospective client. And I called ABS. I said, great, I got someone who's wanted to sign as a client. What do I do? And so they helped me with the contract. And now that I had them signed, I came running back. I was all excited. I got my first client, and I sat down and shared maybe a glass of wine with my wife in celebration. And then I said, great, now what do I do? So I literally had no idea what to do. But my point is that it was a phone call. I don't want to sound like a commercial, but it was a phone call that away from getting whatever information you needed. And the folks in the support department just said, okay, here's what you do now, here's what you do now, here's what you do now, and you'll get it. I mean, over time, say, okay, this is not rocket science. You just got to go step by step, and then you'll be a full-fledged biller here very soon.
That's a question a lot of people have about ABS. What happens once I've gone through your training? What kind of support and ongoing training, do you give? And you mentioned earlier, we've got a great website out there, don't we, for licensees?
Oh yeah, it's the support site. It's the I think abslss.com is what it is. Yeah, there it is right there. And it's pretty remarkable. There's pretty much everything you need to run a business is listed there. I mean, not pretty much everything you need to run a business is there. To me, what's the most important thing, because when I talk with prospective licensees, if they give me a call, they'll say, what's the hardest part? And I always say, getting a client. Well, everything that you need to get a client and develop marketing plans is right there. It's right in that site. And you can take you can run with lots of different things, but everything is right there. So the site is something I used daily when I first started out, and now whenever I need to, I go there.
Yeah, in fact, I just clicked on the news tab, which is where you should start when you log in. Each time you log in here, this is for our licensees. Once you've gone through our training, folks, you'll have access to this with a login and password. As you can see, we post things constantly. Here's something yesterday, 3 days before that, and so forth. It's just filled with new stuff constantly. You can see over here on the right, folks, that we started this back in October of 2014. You see it right down here. And so every week there are several posts on this site, and like Jeff said, it's just filled with information. Jeff, I think we counted up when we took all the videos that we have posted over there on training, on different aspects of training. It's like over 200 hours of training. So your initial training, folks, is really very short. I mean, within 30 days, you can go through all of our training online now. Jeff, did you know that we're doing online training now?
I do know that. Yeah, I had the pleasure of being in Texas for a week, and that was fun. But online is certainly more efficient, that's for sure. And by the way, you mentioned, that's a quick aside, not real on Patrick, but I can tell you that on my business website, I've got 2 videos that are taken directly from the ABS site. I've got them right on my site there. I've got one on iDocs now, kind of a review of that, and then I've got a video that is a physician talking about why they use an outside billing company. So it's right on my website. So those type of things can be used as you build out your business.
Yeah, yeah. Okay, so there's a bunch of questions here, Jeff. I'm not going to get to all these, and I know you have to run here pretty quick, but I'm just making sure that Eric is still behind the scenes. Eric, audibly?
I am.
Okay.
I'm right here.
Answering a few questions there on the board as we go along. Some questions, folks, are things that are just real specific to you. Like somebody said, is this going to be recorded? We answered that yes to that one person. So, you know, some things we'll answer by typing in the questions. So be sure to go back to this board and look and see if we've answered that. Let's see, but I want to ask a couple of other questions, Jeff, before we let you go, because they're related directly to you. Now, this one's a tough one because I don't know how to answer this myself, but we can kind of at least give them an idea. Sharon says, how much income reasonably can we make? Well, that all depends on the person, right? And how many clients they have, of course.
It does, yeah. And I can tell everyone that I'm not going to share how much income I'm making. But I can also tell you kind of an interesting story. I finance the entire fee, the entire licensing fee, 100% of it on a 0% credit card. And I thought, you know what, I can make this money back real quickly. So I got things rolling, and I can tell you that, and everyone knows what the licensing fee is. So I can tell you that I was able to pay that off using revenue from my business within 6 months. So you can do the math on that. Again, my business has grown since then. It can be really lucrative. You got to work. It's not easy. I'm not going to pretend that it's easy, but if you're willing to work, and if you're willing to promote your business and get out there and talk to people, it's a great business. It really is.
Yeah. You answered this earlier. Ivan may not have been on here at the time, but he says, how long did it take you to get your first client? I think you said 2 months.
2 months. Yep. 2 months almost to the day.
And the second came along a month after that even.
Exactly. Yep. Yep. So I got real busy relatively fast. I mean, the 2 months it seems like a long time, and but once I got the clients going, then I got real busy real fast. And
yeah. John wants to know, John says, how difficult is it to replace or displace an existing medical biller? I think he's talking about a medical billing company that's doing the billing right now. Have you run into that? Have you ever gone in and replaced an existing company?
Yeah, my first 2 clients were ones that I replaced. It just, you have to talk to people and determine if they are happy with their biller or not. As I say, I think I mentioned earlier, you'd be surprised at how many people are not happy with the service that they're getting. And those are the folks that again, if you're willing to work and care about the people that you work with, those are the people who will switch their business to you. Conversely, if you have a billing company that's doing a good job, you're probably not going to replace that company. You just might not. However, we've got, again, so many things that we can bring to the table that a typical company cannot. I think, at least I trust you're going to talk about the telehealth opportunities, coming up, Patrick.
Yes.
Maybe, I don't mean to necessarily right now, but I mean, something like this I can confirm is on the forefront of every provider's mind with the pandemic that's going on right now. And this is something that we can bring to the table that perhaps another billing company may not be able to bring. So roundabout way, some companies you're going to replace pretty easily. Others, if they're doing a good job, you go on to the next prospect.
Yeah. Now, did those 2 first clients have a contract? Did they have to get out of the contract with the other biller?
Let's see. The first one definitely did. And the second one, I don't know if they had it was kind of I don't think the second one did. I think it was a loosely, handshake-based contract type thing. But that particular client is real happy with what we're doing. I was able to increase her practice revenue by 29% in the first year and 9% last year. So, you know, she's ecstatic with what I'm doing.
This question is from Ted. He actually tapped in there a couple of times. I guess he didn't think we saw the first one, but anyway, he's talking about dentist offices and big healthcare clinics. Now, Ted, just so you know, when you say healthcare clinics, we do have licensees who've signed up big doctor groups. If those doctors are independent doctors, even in a big group, well, one lady signed up one that has over 80 doctors in a group. So it is possible, but I think you're probably maybe referring to facilities like, you know, hospitals and so forth. And that's not really your target market, Ted. In our business, we found that that's just full of red tape and all kinds of headaches. The doctors, you know, hospitals already have that figured out. Most of them do. So it's hard to go in and get those kinds of clients. Dentists, you know, we are introducing a dental billing. You probably don't even know this, Jeff, but we haven't announced it yet. But we do have a partnership we're working with right now to set up with a online cloud-based dental billing. Now, I don't know how big a market that is compared to medical, because not that many people have dental insurance and not many people go to the dentist compared to how many go to the doctor. But it is a market. Some people think that there's a market out there, and so we're putting that together, you know, here soon, Ted. Just get back with your ABS rep and ask some more about that. Okay, well, Jeff, I'm going to show a couple of things here that you might want to just kind of stay on in the background at least and watch, because Eric and I are going to talk about how practices can use telemedicine to survive the rapid decline in office visits.
Good. Yeah, perfect. Yeah.
Jeff, thank you so much for your time putting in this today. And hey, you can jump back anytime you want to. I just didn't want you to feel like you had to sit there and you know, just be a pretty face.
Okay. Yeah.
He's a good looking guy.
But yeah, the sooner I'm off, my face is gone, the better for everyone, I think. So I will stay on and listen to this. I'm going to click my camera off here though. But yeah, just let me know if you need anything else. But thank you, everyone, and I wish you wisdom, everyone, with doing your due diligence. You know, check it out. It worked out for me. But again, do your due diligence, and I think you'll find it's a great opportunity. So.
Thank you, Jeff. There may be a question or two here specifically aimed at you, and if so, we'll bring you back on, okay?
Sounds great. Okay, thank you.
Yeah. Eric, this is, yes. This was April 15th. Isn't this April 15th? Yeah, this just came out. So what a perfect timing for what we have found. Why don't you explain a little bit about the whole thing about what we're talking about when we talk about telemedicine here?
Yeah, folks, and if you want to find that article and put it up there on the screen whenever you can, folks, and obviously with the pandemic that has come out, it has caused doctors to try to figure out how to do a different way of doing business. And obviously, everyone on the call today has probably heard of telehealth or what's called telemedicine or e-visits or whatever you want to end up calling it. But this article just came out today, that first article, and it's got a little video in there, and so you can go and kind of go watch that. But it's how practices can use telemedicine to survive. I mean, Patrick, isn't that what we're talking about here? And I know in the back of people's heads are going, okay, well, if I give them a telemedicine platform to use, well, how do I make money? Well, we've got ways in which you can make money at this. But think of it, folks, Patrick, as some of our licensees right now, and a lot of brand new licensees that are right now that are actually utilizing the whole telehealth, telemedicine platform that we have to actually get appointments with doctors, and they're not even visiting the doctors in person.
That's right. I'm sorry. I'm looking at one of the comments here by, I won't say who it is, but anyway, one of the people that are on here says, I mentioned April 15th. He says, Happy April Fool's Day.
Yeah, of course. Yeah.
Well, fortunately, this deadline for taxes was put out till what, July or something like that. So that's a good thing, I guess.
Yeah.
Here's another article. Survey: private practices turn to telemedicine to offset the coronavirus dip. This is incredible.
Heard Jeff. Yeah, you just heard Jeff. I mean, some of his clients are kind of dropping, but if other practices are doing this, I mean, these numbers are staggering.
Yeah. Yeah, it is. The survey found that in mid-March, 28% of respondents were only offering telemedicine. Only 28%, and 63% were still performing on-site care. Most of the practices still performing on-site care expressed interest in options to move to hybrid or exclusively telemedicine-based care. Folks, this is the future of medicine. And all we were pushed into it by the coronavirus, that's all that happened, is doctors are now being pushed into it. And Eric, we have a solution for that already, don't we?
We certainly do. And this one just came out just yesterday from Fierce Healthcare. Industry voices, telemedicine's time is time to shine. Can credentialing keep up? I mean,
Yep.
Look at this quote here. People want to know if you can make money in telehealth, telemedicine. That's going to show you right there. Through 2025, it's just going to keep growing.
Yeah, I'm going to underline that so you can see what the number is here. It says it can hit 130 billion by 2025. Eric, that's just 5 years from now. Think about how fast a growth that is.
Yep.
It's increased 53% in 1 year's time from 16 to 17.
Yep.
And that's a lot of money. You know what? You just need a little bitty piece of that pie.
Yeah. And obviously, I know that you're trying to think, well, how do I make money at this? Well, there are cash flow things in which the doctors, as they're adopting telemedicine or telehealth, it actually gets into new areas where the doctors can actually make more money on that service. Just right now, as everybody kind of knows, that just like you see Patrick and me right now on the Go-To webinar, a lot of doctors are trying to just see their patients just in some type of video format, whether it's like WhatsApp or Zoom or any of the other video sharing platforms, but they're not HIPAA compliant.
Right.
And the new service that we have rolled out actually does that. Now, Patrick, I think you've got a little video just kind of sharing a little bit the possibility of where this thing's going, because it's going to be really after the coronavirus has kind of died down, of where those that are with ABS and have the service at hand, we're going to actually be able to show this, how the doctors can actually increase revenue and even further than that. So he's going to play this quick little video.
What if you could streamline the communication between patients, their preferred doctors, specialists, pharmacists, and more? For patients, put your doctor right on your smartphone. Need to make a tele-appointment? Just a few taps. When it's time, your doctor appears on your phone to talk privately and at your convenience. Meets the same HIPAA privacy standards as doctors' offices. For physicians, is a time-efficient way to stay in touch with patients. In just a few minutes, you can see a patient who might just need a prescription or follow up with one you're worried about. It's like adding another exam room, but without the cost. For pharmacists, puts a doctor's office in your store. When a patient needs a refill or medical care, vital signs are taken and relayed to the doctor through the call. In a few minutes, the doctor sees the patient via your computer and can prescribe. Schools use them to take better care of their students by connecting them to their doctors and parents, all on the same call and without anyone having to leave their office. The whole idea is to make healthcare more personal and more convenient. It connects everybody: patients, physicians, pharmacists, schools, and employers. Because healthy relationships are good for you.
Okay.
Future of medicine.
That is the future of medicine right there, folks. Now, that's just a little preview of the service that we already have for our licensees. Our licensees are able to go out and, Eric, why don't you kind of share some of the things that have happened here recently with some of the licensees?
Well, I was fortunate enough to work with one of our licensees. Now, Patrick, what did we do? Roll this out, I think, April 1st? I mean,
yeah, just a couple of weeks ago.
15 days ago. Our licensees are already out there. They're already sharing this. It's just amazing. One of the licensees, I was on a demo with that licensee this morning with a group of 26 providers. He said he would have never gotten in front of those doctors unless we had this service.
There you go.
That is just amazing.
Yeah, now this is a part of that quote from the last article that I just showed. I don't think I did that right. Sorry, let me try that again. I'm supposed to be showing the keynote. Here it goes. Okay, let's try this. Yeah, it says by late March, private practices were experiencing a 35% decline in patient volume. Think about that, Eric. That happened that quickly. Didn't we just stop the travel from China at the late January or something like that? So here, a couple of months later, 35% decline, which raised the alarm around the inability of patients to access care and operational viability of private practices should the trend continue. It's just a huge problem right now.
Right. Yeah. It is a huge problem. And folks, again, what we're trying to do here, we're not trying to sell you on anything. All we're doing is sharing with you, and Jeff is still on here, so he's learning a lot of this as we kind of go through this. And we're just saying that we keep adding new services for our licensees to get you in front of the doctors. And there's a question that came in about, how does a doctor see their patients and do physical exams? Well, obviously they can't do physical exams via telemedicine, but they can, utilizing the technology that's right now, have a quick house visit with a patient. For those that know anything about where medicine is going, doctors have to keep up with what's called chronic care management. And the doctor, the way that Medicare actually reimburses the doctor for that, their patients that are on Medicare, which are mainly 65 and older, they have to have one chronic condition. Well, that one chronic condition could be high blood pressure. It could be diabetes. It could be overweight or whatever it might be. That qualifies that doctor to do a chronic care management online visit without the patient ever leaving their home. It doesn't disrupt the flow of traffic that's in the doctor's office. And that it's not the doctor that actually has to have the visit. They just have to be over that particular visit. So that means a nurse, an MA, could actually be doing this visit, which is going to add another $65 to $80 per visit with their Medicare patients. Now, Patrick, I think the numbers that we got back, this could literally add another $8,000 to $10,000 more a month to the doctor's office just by utilizing a telehealth platform for chronic care management. Well, guess what? Because they're using our service, the doctor using our service, you actually get an override on the revenue that is shared there. That's where you could be adding another $500, $600, $700 per clinic just to your bottom line, and you're not even really doing the billing. But I'm going to end it with this. You talk about a great way right now for you to build trust with these doctors' offices like no other service that I think we have right now that can help you build trust right now.
Right. They want to talk to you. In fact, Eric, I think you sent out an email to a few doctors, and 2 or 3 of them called you up and said, "When can we talk?" That's how.
Matter of fact, you're right. Matter of fact, I just heard yesterday with one of our doctors, he has already shared this with a nursing home. The nursing home is actually is getting on the platform, and I didn't even do anything.
Yeah, it just builds by itself almost. Now, folks, to answer that question, by the way, there is technology available and tools available, including stuff on iPhone apps now that can monitor you and your heart rate and other parts of your body, different things that's going on, that the doctor can actually see on their iPad or tablet or computer if they're in their office. So believe me, the technology is going to figure this out to where you do not ever have to go physically to a doctor ever again, unless you just want to.
Colette's asking the question, what about behavioral health in psychiatric clients? This platform is the perfect fit within there. Matter of fact, there is a complete behavioral health portion of our telehealth platform that we actually have that is specifically for licensed counselors and psychiatrists and behavioral health groups. It pretty much is amazing. And you talk about, Patrick, this is so funny. Well, I say it's funny because we always talk about our technology is always on the bleeding edge of technology.
Right.
I just discovered just yesterday that our technology partner can actually set up within like a nursing home or an assisted living, an exam room in that facility there, and the doctor never has to show up because the stethoscope, the otoscope that goes in the ear, the thing that looks in the mouth is all Bluetooth capable. And so the doctor can say, okay, well, stick that thing in your ear and let's look at it in the other ear. And then let's take your pulse and let's do your blood pressure. And now take the little stethoscope thing and put it here. And it can listen to the heart as good and as well as it can if they were using a stethoscope and they were right there in that office.
Yeah, now
it's unbelievable.
Yeah, now there's some things, obviously, we're getting a few questions and comments here about, what about physical therapists, for example? Of course, to do physical therapy, you'd have to go in to initially see what that's like. But could the physical therapist, once you're at home, monitor and give you guidance? Yes, that can all be done, folks. If you haven't used Skype or FaceTime or some of the other technologies that we're using right here, GoToMeeting, for example, or Zoom, you'll see that you can actually see that person just as clearly as you could if you were sitting in front of them, if you position the camera correctly. So that will all be figured out. Believe me, it's just a matter of time that doctors would not have to see the patient, except in some situations.
Yeah, it's completely amazing, and it's not like we've reached out just to any old person or any old telehealth platform out there. We've been actually communicating with this company for the last year. It just wasn't ready to roll out.
Right.
But when the coronavirus hit, it was like, we got to get this on our books. And so
there are some things that are more revenue directed. This one happens to be one of those. It's a great door opener to get you in front of a doctor. They want to talk to you about telehealth, but it also has a revenue for the doctor and for yourself, as Eric mentioned earlier. So again, ask your ABS rep a little bit more about this. Eric, I think we spent a lot of time here on this, and we're getting to the top of the hour here. So I wanted to find out if we can dig into some more questions here, because I know people are dying to know more about some of these things. And some of this was aimed at Jeff. So Jeff, I may ask you to jump back in here for this question. Dave says, what is it that in the doctor's office that the staff is responsible for in this process of you doing the billing?
Well, let's see. Usually, I'm trying to think of examples here. In offices that I have as clients, I guess what I've tried to do is I've tried to identify kind of a point of contact or someone that I can call with questions about a patient's insurance. If something doesn't look right, or if I can't find the correct insurance that that should be on their chart, I always will contact that person and double check about that. So maybe just making sure the records and charts are up to date. Although the iClaim system does have real-time eligibility, and we can check, in many cases, whether insurance is in place. But if they have the wrong information in there, that's something that has to be corrected. I don't know if I answered that real well, but I guess my general point is that I usually have, or try to have, kind of a point of contact and just someone that if there's any questions that I can call and ask for information.
Yeah, if they're using the iClaim system, of course, on their end for setting appointments and so forth, they can check the eligibility themselves. They can put in the patient demographic information, so you don't have to be responsible for typing that in. I mean, a lot of stuff can still be done. But folks, we don't cause people to lose their jobs. What we do is reallocate their time. That staff member could be spending time helping the doctor see more patients and see the patients more effectively.
That's a fact. That's exactly right. You want to, especially now with how important patient contact is, you want to have all hands on deck and make sure that patients can see a provider or a nurse or what have you, as opposed to someone plunking away at a computer. So.
Yeah, Eric, do you have another question there for Jeff? Do you see one specifically for Jeff?
Yeah, that's what I was looking for. I think we've got all of these that I was.
Here's one. Well, here's one from Steve. I think, Jeff, you could address this. What kind of improvement in insurance rejection rates can you pitch to the practice?
Oh yeah, that's a good one. It's I can't recall. If there's been maybe a few this year, but it's really rare when you'll get something rejected as long as the information is correct. I mentioned earlier that denial defender, which is a product that I routinely add on to my clients' iClaim systems, and all my clients, by the way, have iClaim. They see it, and it's such an improvement over what they typically are using that they'll switch over, or they have switched over easily. But it's under 2%. I think it might be. I haven't really looked at it lately, but I'll bet it's 1%. Of claims are rejected. In other words, almost none. But there's tools within that iClaim system that allow you to check to see if a claim is going to go through or not.
Yeah.
I think someone's asked, how long has Jeff been doing this business, and how many clients do you have as of today?
Sure. I've got, let's see, I've got 4 offices right now. I am about to sign a 5th one, and hopefully a 6th one, maybe a couple months or so from now. They're a little bit earlier in the process. And let's see, those are billing clients, or billing offices rather. I have 4, at this point, 4 payment processing offices. We haven't talked about, payment processing, but as I mentioned, there's a lot of different revenue opportunities you can bring to an office. One of them is payment processing if an office doesn't have that. And it's quite easy. Once it's established, that you literally do nothing other than just make sure that they still like it. And every month I get a check that goes into my bank account. So every time a credit card is swiped, I get a small portion of that transaction. So.
It's almost like we have so many different services. I forget about that. Eric, you and I have not talked much about that, but you can offer merchant services to the doctor and make, like you said, residual income, and you don't do a thing. That's just money that comes in your mailbox each month.
Literally do nothing. I mean, once it's set up, you just check to make sure in your bank account, and yeah.
I wanted to address, Dave says, please respond to a referral question. And I'm looking ahead of that.
I'm looking too. I cannot find it.
Yeah, I don't see specifically anything about a referral question, but you did ask a question here that we can address. Does the doctor's office need to be trained? And if so, by who?
Yes, definitely they do. If they are implementing or getting the iClaim system or the EMRX system in, that's done by ABS, or by the partner, I guess, the iClaim partner. They set up there's a whole series of training sessions that can be set up. I'm always there when they are first looking at the system, and letting the office know that if they have any questions, they can call me. I can get answers to them. I always want to be their point of contact. And you kind of want to keep your finger on the pulse of the practice here, in my opinion. But it's done by that's part of the ABS support. I again literally knew nothing about it and about how to do the billing part, or definitely nothing about how to do the training part. But I turned that over to ABS, and it was taken care of.
Oh, I see. Dave is making it clear here. And Dave, I'm sorry, the technology, sometimes these questions get deleted by us accidentally hitting the little garbage can right in front of them as we go through them. Maybe we deleted that question earlier, but he's saying something about in a contract, if you set up a doctor with a contract for 2 years, for example, Jeff, could you extend the contract and keep it at, say you had quoted the doctor 5.5%? Could you keep it for the next 2 years if the doctor gave you a referral, for example? Would that be a way that you could, justify keeping his down and not going up on his percentage?
Sure. Yeah. You can do lots of different things with the contracts, and I've done, as I mentioned, lots of different methods of invoicing. It's just what makes sense for the practice. But sure, yeah, that's a good idea.
And Dave, yes, this can be used for chiropractors. Do you have any chiropractors signed up?
I have a chiropractor as a payment processing client, but not as a billing client at this point. But as a payment processing client, I do.
But you could, Dave, you could bill for chiropractors. We have a lot of licensees that have chiropractors, yeah. And he also asked, how long can a contract be created for? Do you set up a contract with the doctors for a year at a time with automatic renewal, or how do you do that?
Yes. I've not had any issues at all with contracts not being renewed. I mean, I think there's a 30-day, clause in there for both parties. If I want to, walk away from a client, I have to give them 30 days notice, and conversely, they do as well. But I believe all my contracts are year to year, and it's not to say you can't set them up for longer, but if they're happy with the work that you're doing, they'll renew.
Yeah. Steve says, is marketing is it the goal to meet with the doctor, him or herself in the office, or with someone else?
I can tell you that when I was looking and looking at prospective clients, I met the doctor maybe one time, or the provider one time. In my opinion, you can get all the information that you need. Now, you're eventually going to have to meet with the doctor, or because they're the practice owner and they make the decisions, the purchasing decisions. But up to that point, I talk with the receptionist, and then I typically try to go for a meeting with the office manager, because they really know all the information about what's going on in the office there. Doctors sometimes don't even know what's going on in their own office from a business standpoint, other than they get their paychecks. And I'm being a little bit facetious here, but a lot of what we have to do in preparation for signing a client, in my opinion, can be done with the office manager. But you do have to meet with the doctor at some point.
Yeah.
Eric, anything else there that you see? It's been an hour, Jeff. I'm going to let you go, buddy. I'm so sorry to pull you back in here like this, but hey, get with us if you want to know more about the telemedicine thing. We'd certainly share anything we can with you on that.
That sounds great. No, I definitely will, for sure. Thanks, everyone. Thank you.
Absolutely. Thank you, Jeff. I love this. Dave says, "Can we hire Steve? Is he for sale?" That's
well,
awesome.
Eric, we didn't get to all the questions, but folks, there's just sometimes too many pouring in. However, we will forward these on to your rep here at ABS. Somebody who invited you to this webinar is the person that you will hear back from on some of these things. Meanwhile, Eric, I think I'll tell them a little bit more about our guarantee. We have a money-back guarantee.
Yeah, you bet.
Yeah. Not many companies that license a business opportunity or sell a franchise have a money-back guarantee, but folks, we offer that. It's right here in writing. You can see if at the end of the training, for any reason or no reason at all, you do not think this business is right for you, simply tell us, and we'll arrange for you to receive a full refund of your license fee. We do that, folks, because we know what we have. We've been doing this for 26 years. We've only had a handful of people ask for their money back, so that should tell you something right there. So there's lots of ways you can get involved in this business. One of them is, of course, to look over the downloadable research guide. Here's a picture of it right here. And you can get that from your ABS rep as well. Just email them back and ask them for that research guide. It's 50 pages of good information. And browse our YouTube channel. Here it is right here. It's youtube.com/ABS. Folks, there's probably maybe 200 or so videos on there that you can watch. Some of our past webinars. This one's being recorded, of course. So if you didn't catch some of the, sometimes we play a video and people don't hear or see it good. Usually it's recorded well, and it'll show back when you watch this recording of this one. Also ask them for an owner reference list. We've got people like Jeff who will take your phone call and talk to you personally about whether or not this is a good business for you to be in. Then ask for a demo of our iClaim platform. We don't have software that comes on a CD like some companies do. We have a system, so we have to show that to you live right over the internet. And we'll be glad to do that with you. We set it up with you, whatever's convenient for you, and just spend time showing it to you and answer your questions. Then review the purchase agreement. It's a real short little purchase agreement that you'll be signing with us. Get your funding done and get scheduled for that training.